So when I had my son, when we got to about 32 weeks, the doctor had said, if you have to have the baby, we could probably save the baby, but not you, which was very scary. And then I ended up with a C-section and just had some experiences there that scared me to the point that I did not want to go back. I mean, I just didn't, and that's probably the biggest reason that I never went back to the doctor until my episode, years, like 33 years. Got really sick. Then it was like I didn't want to be judged to go, so I never did do it. And then I ended up in the hospital here. And so, yeah, that's where the journey began. My blood count was a 2.9, which should be up over 12. And then I was in ICU for one night, and then for 4 or 5 days after that, I was in the hospital just because I ended up with 7 blood transfusions and 5 iron transfusions before they'd let me go home. I was diagnosed with stage 4 ovarian cancer that had spread to other parts, into my diaphragm, that they saw. And so, which is when you hear stage 4, it's like, whew, poor Paul, it was tough there for a day or so. And then we just decided we're just going to beat this. We're going to hit it head on and keep a positive attitude. Because I had my nurses, I had my gynocs, I had my general, which is Dr. Peel here at Livingston HealthCare. And so they've all worked as a team, and they all know everything that's going on with my health and my procedures.
Sorry. Blame it on Jess.
I've had 14 rounds of chemo. You never once, when you walked into that infusion, ever felt like it was a bad place. They always made it a good place. Because I can go 10 minutes to our hospital and I can have it done. And I'm not going to travel in the winter, and it's local. I know the people there, and that's where I'm going. Actually, with all the treatments that I did, that actually has shrunk that tumor. So in June, I get to go and I'll have surgery and remove it, which was not expected when this all started. They said there was no way I'd never have surgery, and then we'd have to treat it accordingly. And they gave me about 2 years maybe to live. And now I make sure that I'm on the right, life changes from diet to exercise. Then I just got back from a 7-day cruise to Alaska, and that was awesome. I was able to walk, and we've been married 43 years in June. And so we kind of know each other like no other. And so he's been my rock star. The new things in our lives is our grandson, who was just born a week ago. We're first-time grandparents, so little Walker came to us, and so we're super excited about that. We do the Calamity Rodeo that is in August, and for 40 years we actually did the Livingston Roundup, and then we retired from that, but that lasted 1 month. And then we were back helping produce this rodeo.
Ornery in the best ways. Just such a positive person, and I think she really made a huge difference for herself that way.
It was definitely great relations with Val and the entire team here. I never felt like I was a patient. I felt like I was just a visitor and a friend.
Just the convenience, I think, alone is huge. She was able to work through her whole treatment. We worked with her, and so most of her treatments were on her day off. So, not having to drive back and home, and, sometimes we'd have her come in the day before for labs or her appointments. And so just being able to do that while still living your life, I think that close to home. And then seeing us out and about, I think is huge. It makes it more than just a nurse-patient relationship.
And if I can help one person decide they really need to go to the doctor and it's not a bad place, that will be a great thing. Because there's a lot out there that don't. I know that. And so it changed my life. Getting things on target, and I'm here, and I don't look to go anywhere because I feel so good.